The American Heart Association has been recommending a low-fat diet for nearly the last half-century. This low-fat diet has been really promoted since the late 1970s, when all the cholesterol drugs and studies were being promoted. However, a large amount of the research into the #1 killer throughout the world in both men and women is now showing that heart disease is not the result of too much cholesterol and fat in your bloodstream, but instead is a result of a low-grade inflammation in your arteries. Over half of the patients who suffer a heart attack actually have normal cholesterol levels. This fact, combined with the knowledge that those individuals who consume a Mediterranean diet where 40% of their calories actually comes from fat, and they have the lowest risk of heart disease in the world, has forced the American Heart Association to reevaluate their diet recommendations. Recent large studies validate the 2013 American Heart Association's new guidelines on diet and lifestyle management to reduce cardiovascular disease. These guidelines now recommend a dietary pattern that emphasizes fresh whole fruits and vegetables, whole grains, legumes, fish, poultry, and nuts, along with vegetable oils for fat and restricted consumption of saturated and trans fats, sugar, sodium, dairy products, and of course red meats. These dietary recommendations closely follow the dietary pattern seen in the Mediterranean diet. The details of these dietary guidelines was reported in the January 28, 2014 Journal of the American College of Cardiology. The key in these new recommendations is the fact that not all fat is bad. There is good fat and there is bad fat. Consuming monounsaturated fat and omega-3 fats found in vegetable oils, nuts, legumes, and cold water fish can actually decrease the amount of inflammation in your arteries as you decrease your risk of heart disease. Therefore, increasing your dietary intake of these good fats as you decrease the amount of saturated fats and eliminate trans fats found in processed foods, dairy, and red meat is the key of these new recommendations. At the same time, increasing your intake and variety of fruits and vegetables helps to provide the important micronutrients needed for optimal health. The Nurses' Health Study and Health Professionals Follow-Up Study showed that those individuals who had the highest consumption of fruits and vegetables when compared to those with the lowest had a 17% lower risk of developing coronary artery disease. In a separate analysis, increasing consumption of nuts was associated with a stepwise reduction in all-cause mortality. The higher the individual's consumption of nuts, the greater the reduction in the risk of dying from any cause. Those individuals who ate nuts every day had a 20% decreased risk of mortality from all causes compared to those who did not eat any nuts. This was even truer in decreasing the risk of dying from heart disease, cancer, and pulmonary disease. Other studies showed that eating red meat, especially processed meats, less than once weekly was associated with a decreased risk of both heart disease and cancer and actually increased longevity. In conclusion, the key to a healthy diet is actually increasing your intake of those good fats that are found in vegetable fats, fish, nuts, and decrease your intake of those bad fats, which are primarily found in red meat and dairy products. This, along with increasing your consumption of fresh fruits and vegetables, nuts, and legumes, is critical. It is also important to decrease your intake of processed grains, the almighty white potato, as you eat healthy whole grains. The only thing that I would add is the fact that I recommend that all my patients supplement this diet with high-quality nutritional supplements that provide cellular nutrition. This gives you the absolute best chance of protecting your health.